Good evening. This is Dr. Klein coming to you from Raleigh, North Carolina. You can follow me on YouTube under Thomas Klein MD and on Twitter, Thomas Klein MD. We're trying to be modern and get the word out. The point is that everything we say we can back up. This is not making flat statements like addiction is worse. Addiction is not worse. That's a flat statement. It's not backed up by any facts. So before we get started, there's two things we forgot about hyperalgesia, which we did previously. We did a poll, 324 people. Only 6% possibly had it. Pretty rare. And under fibromyalgia, the biggest problem with fibromyalgia and fatigue syndrome is this horrible, just absolutely terrible fatigue that comes over people. It's kind of like if you've been up all night, how you feel, or you're just getting the flu and you're in bed and you have this terrible fatigue. The question is, do opiate pain medicines help? According to 208 people, 81% said it really helped a lot. 14% helped some. Only 5% of people with the chronic fatigue that goes along with fibromyalgia said they didn't work. These are incredibly amazing drugs, the opiates. And I do know that at PROP, which is the Physicians for Responsible Opioid Prescribing, their founder, Dr. Kolodny, said that opioid pain medicines are lethal weapons and should be taken off the market. If you take them off the market, there's nothing else to treat fibromyalgia with, because it's the only thing that works. So today we want to talk about how frequent is addiction. How often, if you're taking your pain medicines, will you become addicted? How often will teenagers become addicted if they go to the dentist? Well, the first figure is there is an addiction rate of 25% in the 10 million people that take opiates every day for their pain medicines. And this was a Dr. Andrew Kolodny testifying at the Johnson & Johnson trial, in which $600 million was awarded several hundred people who sued Johnson & Johnson, claiming they made the opioid crisis worse. A lot of people don't know that was reversed in the Oklahoma state courts. The judge said they were probably bad actors over there at the J&J company, like a lot of other pharmaceutical companies, but we don't really see any evidence of injury. So he kind of discounted this 25%. Well, we have looked at this very carefully, and it turns out that the average person has a genetic protection against opioid addiction. And we even know the name of the gene. It's OPRM1A118G. That's the name of the gene. You can look it up on the internet and see for yourself. But what it means, and this is really a biggie, what it means is that 99% plus of people cannot addict to opiates, no matter how hard they try. How do we know? People on IV heroin coming back from Vietnam, only 1% actually addicted. 99% who were taking the heroin did not addict. So Dr. Kolodny's 25% was wrong. He presented it under oath, and the answer is, based on our extensive research, the number of people taking opiate pain medicines who are addicted or who will addict is 0. That's a biggie. This means that efforts to reduce the exposure to opiates, opiate pain medicine, is a complete waste of time. Since the few people, 1 or 2 per 1,000 each year, with the incidence of opiate addiction, are going to show us they have opiate addiction. It's real easy to diagnose. If you line up 1,000 people and give them all opiates, 2 people will go to the moon with an explosive outpouring of dopamine and a feeling that's so wonderful that it's really hard for them to describe. If the other 998 people who you've given the same opiates to will not experience a high, I hate to use that word, high, it means extreme euphoria. So 998 people standing there with their little bag of opiates, and they take them and they feel a little sick or a little woozy, or they might feel pain relief. 2 people go to the moon. And we have 2 examples. Jamie Lee Curtis has talked about her going to the moon on the first pill, and Dr. Grinspoon, Peter Grinspoon, Grinspoon, who wrote a nice book called Free Refills. And so we're going to challenge the notion that people can't addict to opiates. And therefore, what is the National Drug Police doing? What is everybody doing recommending low doses? What is everybody doing recommending less pain treatment? Not getting pain treatment for your teeth. Not having veterinarians give out because you might addict. The people who have taken it previously and answer the question, have you had an opiate before, will not addict. They can't. They're blocked by their own genes. So we're going to be coming back to this. This is a very, very important topic because it means that 95% of the attack on opiates is for naught. Good night.